reviews for evidence-based practice is still in the preliminary stages as far as nursing practice is concerned. So I am sure today's lecture by Dr. Anju Sinha will be enlightening all of us about systematic review and as well as how to collaborate with Cochrane. Madam, we have a humble request on behalf of all nursing researchers in the country. Please help us to establish a Cochrane Collaborating Center for Nursing. Though in AIMS and other places, we have Cochrane centers, but it is mainly involving the medical discipline. Whereas for nurses, exclusive focus is missing in India, whereas I see in other countries, they have separate Cochrane centers for nursing, and they have Cochrane chairs for nursing. So if you could handhold us and help us develop Cochrane nursing collaboration, we will be very happy, and ultimately the patients will be benefited, madam. Thank you very much. All are looking forward for your lecture. We have around 1,300 participants who registered, but maybe because of this time, no, office hours are closing hours. Hope it is going on increasing now. So we will start with the session. And once again, thank you very much, madam. And I thank Muthu, who is the organizing secretary of this webinar, for taking all efforts to keep connected with madam and getting this session being organized. Thank you very much.
Thank you, madam, for your introduction on the topic and the importance of the topic. Now, I have the privilege to introduce the speaker today, Dr. Anju Pradhan Sinha. Dr. Anju Pradhan Sinha is a public health professional trained in epidemiology and experienced in conduct of large-scale community-based field trials. She has worked as surveillance medical officer in the National Polio Surveillance Project of WHO in Bihar, Jharkhand, and UP areas that faced huge challenges in polio eradication in India. As Senior Deputy Director General, Division of RBMCH, she coordinated research opportunities to bring out effective strategies for prevention and control of morbidities among women and children. She expanded the scope of research in child health in the areas of childhood and adolescent anemia, injuries, social pediatrics issues like children living in difficult circumstances, prevention and management of prematurity, role of probiotics in women's and child health, and evidence-based child health. Presently, she is the director of the Cochrane Affiliate Center at ICMR headquarters in Delhi and co-chairs the recently established Cochrane India Network. She is leading a MRC UKRI funded a trial on role of pediatrics in prevention of national sepsis ongoing at 6 sites in India. She is actively involved with training and capacity building in systematic reviews and has produced quality collaborative systematic reviews with recognized national and international impact. She is the recipient of the Aubrey Seham Public Health and Primary Care Scholarship and the Kenneth Warren Award from the Cochrane Collaboration. She has more than 60 publications to her credit in national and international publications, and we are today, fortunate to have such an expert in the field of systematic review and Cochrane collaboration to get enlightened about this topic. I welcome you, madam, for the webinar.
Thank you very much, Dr. Muthu and Dr. Lata, for this warm welcome. This is my first interaction with the Clinical Nursing Research Society. And as ma'am said, we are just neighbors and we need to interact more. And ma'am, I took your point regarding separate nursing Cochrane collaboration for nursing in India. I was just thinking, because AIMS is also one of the affiliate centers, so why not you can join hands with them? But you mentioned that other countries have separate, this division is there for nursing professionals, so maybe we can always try this. And at present, the Cochrane India network is getting stabilized, and after 2 years, it will open up for more, entrants of other organizations. So thank you for this opportunity. At the outset, I thank you. And the topic about Cochrane, rediscovering the future of nursing research. I would like to present a few slides to you. And Just give me 2 minutes. There's some technical glitch with the. Yeah. So I would like to start my presentation by remembering a few eminent people who work in the area of evidence-based medicine. So evidence-based medicine, as you may be aware, is a conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. So in this picture, you see a gentleman with cigar whose name is Archie Cochrane, after whom the Cochrane collaboration is named. He was a dental epidemiologist in the UK, and he was a great proponent of randomized controlled trial. And he has written this book, Effectiveness and Efficiency, Random Reflections on Health Services, where he mentions that it is very unfortunate that we have failed to take note of the randomized clinical trials and results to modify the health system intervention and improvement. So Dr. Ian Chalmers, whose picture is right below, was a very believer in randomized controlled trials also, and he was greatly inspired by Archie Cochrane. And he was the one who initiated the Cochrane collaboration. Of course, it was done few years after Archie Cochrane's death. Next to Archie Cochrane's photograph is the David Sackett, great scientist from McMaster Clinical Epidemiology Research Center. And next to him is Gordon Guyatt. He's the one who coined the term evidence-based medicine. So evidence-based medicine, and since 1995, there were centers for evidence-based practice around the world established, and evidence-based pediatrics and child health was initiated in 2004 in India under IAP, RCPCH, PGI collaboration started. So what is Cochrane? So it is a global independent network of over 36,000 researchers, professionals, patients, carers, and people interested in health. It is not only doctors, but all who are concerned with healthcare can be associated with Cochrane. They respond to challenge of making the vast amounts of best available evidence generated through research useful for informing decisions about health. And Cochrane is a not-for-profit organization with collaborations from more than 120 countries working together to produce credible, accessible health information that is free from commercial sponsorship and other conflicts of interest. So if you look at this world map, it mentions that there are more than 36,159 Cochrane contributors all over the world. And more than 107 countries have active authors who contribute to the Cochrane. And if you look at the author distribution, of course, there is very less participation from lower middle income countries and high participation from the high and upper middle income countries. And there are translation communities also who are actively working in 12 languages. This slide will give you a glimpse about the proportion of the density equalizing map projection of the number of articles per country, and density equalizing map projection of the number of citations per country. And you can see India is lagging behind quite a bit in this, with the other developed countries on top. What is a systematic review? A systematic review attempts to identify, apprise, and synthesize all the empirical evidence that meets pre-specified eligibility criteria to answer a given research question. Researchers conducting systematic reviews use explicit methods aimed at minimizing bias in order to produce more reliable findings that can be used to inform decision makers. So Cochrane reviews are of different types, but the most common ones are intervention reviews. There are also diagnostic test accuracy reviews, methodology reviews, qualitative reviews, and prognosis reviews. And Cochrane reviews base their findings on the result of studies that meet certain quality criteria, since the most reliable studies will provide the best evidence for making decisions about healthcare. So important to note here is that quality of the studies matters a lot in Cochrane reviews. Why is it is important to do and learn about systematic reviews? Systematic reviews are considered as gold standard in literature reviews. They have raised the quality standards of a new discipline, which is the evidence-based medicine. And they are one of the preferred methods development of recommendations on best practices, such as clinical practice guidelines, health technology assessment, and research synopsis. And the potential impacts of systematic reviews are as follows. They save lives by distinguishing between what works and what is useless and even harmful. So they save resources by avoiding unnecessary or unproven interventions, as well as unnecessary duplication of studies. They improve practice, clinical quality, and policies by providing up-to-date evidence on specific topics for decision making. So in this slide, you can see the steps that are required in a systematic review. So it starts with a topic selection, then conceptualization of the research question and creation of a systematic review protocol, which is published a priori. Then comes the stage of searching for studies. Both the published literature and the gray literature should be searched. Then the screening for studies, then to the next step, where all we have to screen the title abstracts and the full text articles of all the retrieved literature after our search has been completed. Then we have to apprise studies. By apprising studies, we mean we have to assess the quality of the studies and assess the risk of bias inherent in the studies. So even in randomized control trial, as you know, there are many biases which can be there. So one has to carefully evaluate each study as per the possibility of these biases and then be aware about that. Then we have to extract the data from the published literature, synthesize and interpret our results. This is something known as the pyramid, the evidence pyramid, in which you can see systematic reviews are at the top of the this gradient. The background information, expert opinion, then comes the case control studies, then comes cohort studies, then randomized control trials. These are the unfiltered information. And after that, critically appraised individual articles, which is also known as article synopsis, then critically appraised topics, evidence synthesis and guidelines, and on top of that, systematic reviews. Now I would like to talk about the Cochrane India network that was established in 2020. Although India has been associated with the Cochrane since long, when it was a branch of Australasian Cochrane Center, and in 2008, the South Asian Cochrane Network and Center was established at CMC Vellore under able guidance of Dr. Pratap Tharyan. However, after so many years of existence in 2020, there was a strategy change in the Cochrane, and they wanted to take a network mode of activities in India, as they have done in USA and in China. So a meeting was held in Delhi, and it was decided that the South Asian Cochrane Network Center would be dissolved, and a network spread all over the country will be established. And 9 affiliate centers of the Cochrane India Network were announced in 2021. And these are located at All India Institute of Medical Sciences, Christian Medical College Vellore, Indian Council of Medical Research, Indian Institute of Public Health, Hyderabad, Institute of Dental Sciences, Bhubaneswar, King George's Medical University, Lucknow, Manipal Academy of Higher Education, Manipal, Postgraduate Institute of Medical Education and Research, Chandigarh, and Tata Memorial Center, Mumbai. At the Indian Council of Medical Research, we have established this Cochrane India Affiliate Center. However, to begin with, ICMR has always been a proponent of evidence-based medicine, and we have done a lot in this area. So the first South Asian Cochrane Network and Center at Vellore was also established through funding of ICMR. And in 2007, ICMR procured the national subscription to the Cochrane Library, making it accessible to all Indian scientists. So this initiative opened the doors of PBM to all the Indian scientists, and there was an increase in contributors to the Cochrane Library from India as a result of this. We have also established an advanced center in evidence-based child health at the Postgraduate Institute of Chandigarh, since 2011 under Dr. Minu Singh. And through its capacity building component, CARD EBCH is training students and young faculty of medical colleges in various parts of India. So capacity building in evidence in the EBM in the Northeast region is also done. And our division, RDMCH, has initiated a funding scheme on secondary research to promote scientists who would like to work on systematic reviews by providing a funding then. Systematic, there was a question that how systematic reviews fit into the framework of evidence-based practice. So in order to answer that, let us understand the systematic reviews, what are they and what is their place in evidence-based practice. The placement of systematic review in evidence-based practice can be illustrated as follows. From primary studies and systematic reviews. So many primary studies are compiled in order to have a systematic review, and then evidence summaries are developed. These formal reviews are fundamental to development of sound clinical practice. However, the systematic reviews do not make any recommendations. Therefore, there is a gap which can be filled by knowledge brokering. And here comes the role of knowledge translation that consists of repackaging the summarized research evidence into clinical practice guidelines, which guide clinical decisions of diagnosis and treatment. However, in our country, mostly the clinical practice guidelines are adopted from the foreign guidelines, and we do not pursue the scientific method of forming our own guidelines. Like the WHO and other agencies do, they commission systematic reviews in order to formulate their clinical practice guidelines, and which is the best practice. So the next step of evidence-based practice is implementation of these guidelines into both individual and organizational levels. And this step entails individual clinical changes in practice as well as organizational changes to institutionalize the evidence-based care. And lastly, we have to evaluate the impact of this evidence-based practice. And this can be accomplished in terms of patient outcomes, provider satisfaction, economic impact, and gaps for future research to identify new research questions. This is something known as the STAR model of evidence-based processes, the cycle of knowledge transformation, which begins from the primary research and then the formulation of systematic reviews and evidence summaries, which are then translated and implemented and then can be evaluated to promote more and more primary research. So again, coming to benefits of systematic reviews compared to single studies, it reduces large quantities of information into a manageable form. So doing one systematic review, so everyday practitioners cannot, keep themselves abreast with the upcoming knowledge, which is in thousands in print media, in journal publications, and in social media also. So therefore, the systematic reviews give you a comprised and assimilated evidence which to keep you abreast about the developments in your area. They also establish generalizability across participants, across settings and treatment variations and different study designs. They assess the consistency and explain the inconsistency of relationship across studies and increase power in suggesting the cause and effect relationship. So many primary studies are done on small samples, but when we combine them in a systematic review and by doing meta-analysis, we increase the power and precision of the outcome. They are done in a scientific manner, and at the heart of conduct of a systematic review is reduction of bias. Therefore, all the steps of conducting a systematic review are done in duplicates, so that all the evidence that emerges is devoid of any bias which can be there in a primary study. It integrates existing information for decisions about clinical care, economic decisions, future research design, and also policy formulation. It increases our efficiency in time between research and clinical implementation and provides format for better continuous updates of new evidence. So there was another question of, the society wanted to know what is the process of dissemination of systematic reviews. So as for any publication, the first mode of dissemination will be publication in scientific journals, peer-reviewed journals. But in order to disseminate the systematic reviews and the Cochrane systematic reviews, the affiliate center at ICMR is planning to create a space on the ICMR website and create a link to the title of latest Cochrane systematic reviews to be posted on the ICMR Health Media WhatsApp group, the ICMR Twitter handle, Facebook page on regular basis. ICMR, as you are aware, supports students by short-term studentship programs, which is conducted by the Human Resource Development Division. And mechanisms we want to encourage the students and sensitize them into early in their career into evidence-based medicine by by this initiative. So we are already having the center which I discussed with you, and the new DG has a larger vision of this evidence-based medicine, and he wants to create such centers across all aims in the country. So in future, we will see many more such centers across the country, and the capacity building in this regard will be very, very essential because the processes have been initiated and more people will be trained to such capacity building initiatives. So we also need to look at how we can translate our systematic reviews into other local languages to be more beneficial to people who are working on the ground and working in different states where English is not a spoken language. Now there was another question to address, how to use the Cochrane website. So let me tell you that during the years 2007 and 13, the Cochrane library was subscribed to ICMR funding. However, like everything which is good comes to an end. So that funding has come to an end. And afterwards, for 2-3 years, the Cochrane library was subscribed with the help of NLM. And at present, all of India is devoid of full access to the Cochrane website, Cochrane library. So of course, you can visit the Cochrane website, but you cannot download the full PDFs from the website. However, institutions such as AIMS, PGI, I believe all AIMS in the country, they have purchased the access to Cochrane library, and it's not a question for people like you who are working at AIMS in Delhi. So this is the interface of the Cochrane library. If you go to cochranelibrary.org, you will find this. So there is a tab for Cochrane reviews, trials, clinical answers, about, which talks about what is Cochrane, and help is also available. So Cochrane library is a collection of databases in medicine and other healthcare specialties provided by the Cochrane collaboration. At its core is the collection of Cochrane reviews, database of systematic reviews and meta-analysis, which summarize and interprets the results of medical research. It is recognized as the best single source of information on the effects of healthcare. And Cochrane library aims to make the results of well-conducted controlled trials readily available and is a key resource in evidence-based medicine. Cochrane, as an organization, is independent, global, that collaborates to produce trusted synthesized evidence and makes it accessible to all and advocate for its use. Internationally recognized as the benchmark for high-quality information about the effectiveness of healthcare. And it strives towards a world of better health for all people, where decisions about health and healthcare are informed by high-quality evidence. So the contents of the Cochrane library are as follows. There is a Cochrane database of systematic reviews. So when we do systematic reviews, it is recommended that more than 2 databases should be searched, because the first premise of a systematic review is to do a comprehensive literature search, including databases, journal searches, and searching, conference abstracts, all gray literatures, possibly theses also, and also the trial registries such as the CTRI to be updated with the new trials which are still ongoing, and to include them after when we are completing the systematic review, we should have the results of those ongoing studies as well. So in the Cochrane database of systematic reviews, presently there are more than 8,800 more than 8,800 reviews and 2,423 protocols. So protocols, as I said, is a priori published methodology of the systematic review, which is a premise and Cochrane at the Cochrane collaboration. In order to do a systematic review, you have to register a title and then write your protocol, which forms the backbone of your systematic review, where you mention each and every detail about your methods, the background section, in the method section, your eligibility criteria, inclusion, exclusion, what type of studies will be included, how you will deal with heterogeneity, who will do what, even to that detail, to that extent, all details are mentioned. All steps of a systematic review have to be completed by 2 people, and their names are mentioned in the protocol. So it is a pre-publication. Before you initiate the full review, you have to complete your protocol and it has to be published, and then you can commence upon the full systematic review. Other than the CDSR, which is the Cochrane database of systematic review, the Cochrane library also has a central register of control trials, which takes from all the websites, the PubMed, Medline, and Embase. Anywhere any trial gets published in any journal, it is within 2 months, I think it gets entered in the central database, and it has all the randomized control trials. So this is a resource for finding randomized control trials. Then there is a Cochrane clinical answers, editorials, and special collections also within the Cochrane library. So no need to repeat that Cochrane reviews are high quality systematic reviews. So we have been talking about them. Cochrane protocols, as I mentioned, they will be undertaken in order to complete a systematic review, and they are helpful as they sometimes include a summary of the topic and some good references. So from here also we can take out some information from what is going to be published in future, but there will be some information about the topic. Trials. So on the Cochrane library, when you do searches, these tabs are there, and under the trial, the tab of trials, you will have individually randomized control trials. They are drawn from a database called Cochrane Central Register of Control Trials, or Central. And then we can also find RCTs in other databases, such as PubMed, Clinical, and other library databases. However, collecting information from 2 or more databases is essential in order to complete a systematic review. And by after having conducted the searches, you have to enter the results in your reference manager, which automatically deletes all the duplicates. There will be some duplication between the PubMed and the Embase. So these are taken care of by the reference manager. Editorials tab contains editorials written by professionals associated with the Cochrane library, and the special collection. These are list of reviews specific to a hot topic, and they will be usually there'll be 0 results in this tab. However, these are mainly useful for background information on a general topic. So this is the interface of the Cochrane library, and it was asked how to give some tips about how to search in the Cochrane library. As I mentioned, at present, you will not have full access to your searches. Even if you do searches, you will not be able to download those articles. However, just for information, and with the hope that someday all Indians will again have access to the full Cochrane library resources. As the co-chair of the Cochrane India Network, myself and Dr. Meenu Singh, we are thinking about how to get this access, and she being the director of AIIMS Rishikesh nowadays, there is a scope that will be done sooner. So the search options are a normal search, then there is a search manager, then there is a mesh, medical terms, mesh tab, and then there is also a PICO search. PICO, as you may be aware, is the how you describe your interventional systematic reviews. PICO stands for participants, intervention, comparator, and outcome. And it is very essential to mention, to be clear about your PICO statement so that you can identify your keywords and your mesh terms when you are doing the search. So again, so these are some of the from the website we have taken from the Cochrane library. When you go to advanced search, you will see thesaurus matches are there, the mysteries, and then search results are there. So this is a snapshot of the search manager where you build your search strategy by preparing your search strings. So one search string will comprise of, one concept of your people, like your participants. You will have the synonyms for the participants. Supposing it is child, children, you will mention ages, and then this will be your one term. Then if you are doing some research, say on asthma, you will have asthma and respiratory distress and other related and keywords and mesh terms included in the others concept. So these will form your concept by concept. You will have these hits from the library when you search them. And then you have to combine all the synonyms using the Boolean logic of OR. So one search string gets combined by the synonyms are combined by using the Boolean logic OR. And then in the end, when you have developed all search strings of your PICO, then you combine them using the Boolean logic of AND. And that gives you the result of your search, final search. So these are the some of the features that I wanted to share with you. However, Cochrane library can also be searched by browsing by the topics. So at present, there are about 52 Cochrane review groups. And you may be aware or you may not be, let me inform you that Cochrane is also undergoing restructuring, and the old Cochrane structure of CRDs is now being modified into thematic groups and evidence synthesis units, and there will be a central the central editorial services. So they are going to be working like any other journal, where they will promote Cochrane systematic reviews as well as accept other systematic reviews done outside of Cochrane to be published as Cochrane reviews by accelerating their the main criticism of the Cochrane system was that in order to complete a systematic review, a huge time is invested by authors, and the peer review system takes a long time. Therefore, they have now tried to strategize this and modify their systems. And some of the UK-based Cochrane review groups are getting closed down for lack of funding. However, new evidence synthesis units and thematic units are getting created all over the world. And there is a great chance that India may also have one of the evidence synthesis unit established in India, because I think for this practice of India has now realized the importance of evidence-based decision making, and in that process, systematic review and the health technology assessment all are very, very important. At Department of Health Research, there is a Health Technology Assessment India unit that is working very closely with the government for Ayushman Bharat. All packages, are being decided with the help of health technology assessment, which comprises of systematic reviews, cost effectiveness evaluation, ethics and legal aspects, and decision making. And all these changes are taking place at a very fast pace. Therefore, there is more and more scope that we will move ahead in this direction, and there will be no dearth of funding for an evidence synthesis unit. It is proposed from one of the centers, premier institutions like AIMS, PBI, Chandigarh, or ICMR itself. There won't be any dearth of funding for these in India. So as I mentioned, once you have completed your search in the Cochrane library, it will tell you how many Cochrane reviews are there, how many protocols are there, how many trials are there, how many editorials, special collection, and special answers are there in your research question. So I think abruptly ending the talk like that, I have not made my thank you slide. So I would like to thank you for your attention, and I'm open to any questions that you may have.
Thank you, madam, for your enlightening sessions. There are a few questions in the chat box I would like to, explain. Priyanka Elizabeth Thomas has asked, Could you please explain difference between keywords and mesh terms?
So, yeah, very important question. Yesterday we had a workshop here at ICMR in which our library scientist from PGI Chandigarh was also here, and she took 2 sessions on search. So as you can understand, it is very difficult to explain everything in a brief presentation. It was a full day workshop. So she has also answered this question yesterday. Keywords are layman's terms of any, and mesh terms are medical subject headings which are there in the library. So in the Cochrane library, there is mesh, and in Embase, there is M3, to explore the scientific terms, the medical terms for any keyword, any layman terms for any disease. So that is the basic difference. You can have your keywords and still you want to go back on the mesh and write your keywords and then hit the mesh. It will give you the medical subject heading and describe how this term can also be labeled and how this can be spelled out, so that you can include those in your search.
Thank you, madam, for your clarification. And there is another question. What is the role or functions of Cochrane collaboration centers?
Okay, so the Cochrane, you mean the Cochrane India Network Affiliate Centers?
Yes, ma'am.
Yes. Okay. So there is a hierarchy within Cochrane. So Cochrane Affiliate Centers are supposed to promote the work of Cochrane. They are supposed to increase the number of Cochrane contributors from India, and they are also supposed to disseminate the work of Cochrane in India. So these are the 3 main objectives of each affiliate centers, within which they are all working. They are all conducting workshops to train. They are also doing systematic reviews, and they are disseminating their activities, and through their websites, they are promoting the work of Cochrane and making people aware. But there are many more ways we can think of. Like after yesterday's workshop, we were thinking that we should create a journal, not journal, but what we create for the study. What is that? Every month we produce that, the flyer, the calendar that we share with our trial steering committee. What is that called? So we can have more and more publications coming out with regard to our activities, disseminate them, and make a forum where all the Cochrane affiliate centers, like we have our monthly meetings, of course, where all of us come together and discuss our activities, and we brainstorm on how to promote more and more about systematic reviews. So there can be a forum where people interested in this area can come together, and they can, like you have in Western countries, you have book reading sessions. So people can come and read their systematic reviews and make other people and have discussions like journal clubs for systematic review. So those are also in the pipeline, and we are collaborating with other agencies working in the area of evidence, such as the Campbell collaboration, the 3IE. We have been given task by the NITI Aayog to promote and do some systematic reviews for the government of India.
Okay, thank you, ma'am. There is another question from a participant. How nursing students can access Cochrane library? I think the participant means that how can they subscribe to the Cochrane? I think that is the core of this question.
Okay, so if you open the Cochrane website, there is a tab which says Join Cochrane. So you can simply join that. You have to fill a form and you can become a member of the Cochrane.
Ma'am, can you explain what is the subscription charges or something like that?
There are no subscription charges to become a member of the Cochrane. You can join the community of Cochrane and you can contribute in many ways. One of them is systematic review. The other ways are to become a consumer. Then you can join the Cochrane crowd, where you can help people translate their, if you are skilled in some, like if you are, say, Chinese people, they can join the Cochrane crowd. And if they know English, they can translate publications in Chinese into English. So there are many such forums. There is also Cochrane for Students, which helps connect students on this forum and sensitizes them on evidence-based methods. So there are many such forums, and another way of doing a systematic review is the very streamlined one. You have to look, think about a topic. You have to look at the Cochrane's review group, which is more, which is like relevant for your research question, and interact with them. Every Cochrane review group has a website. You can look at who's the managing editor, who's the contact person, their emails are given. You can write to them, you can write about your research question. If it has already not been published in the Cochrane library, they will be interested to take on your question. And then you interact with them, they will send you a form, which is called trial registration form. You fill that form stating your PICO, and then they will consider it. And if it fits into their stream of things, then they will approve your title, and then you can start your journey with doing a systematic review.
Thank you, madam. There is one another question. We have done a systematic review, but how to publish them how to publish them that it reaches Cochrane? That's one of the question from a participant.
So let me tell you again that Cochrane systematic reviews essentially were to be initiated by Cochrane. As I said just now, the explanation which I gave, to become a Cochrane author, you have to interact and you have to enter Cochrane as with a proposal of doing a review, and then if they accept it, then it becomes a Cochrane systematic review by first publishing the protocol. First status is the title registration, then the protocol, and then the review. However, now with the changing, as I said, the restructuring of Cochrane, now the Cochrane library will accept, the editorial team will accept which the systematic reviews which are done outside of the Cochrane as there. But it will, this process is also in transition, and it will be 2-3 years more before they can accept your, and it has to be of high quality, and it has to adhere all the Cochrane norms and all the guidelines of Cochrane handbook. So it has to, if it qualifies like that, then maybe they will accept your review which is done outside of Cochrane as a Cochrane review. But as of today, the process is to start with the title registration, to complete a protocol, and then do a systematic. Earlier times when we used to do systematic Cochrane systematic review, they used to allow us to publish it as a journal publication. But the other way around, if you have done it outside of Cochrane and you want to publish at Cochrane as Cochrane review, could not be possible. However, with changing times, this will become possible.
Okay, thank you, madam. There is another question. Can we have when we create a sign-in in Cochrane, can we have a folder or library under our login ID that could be referred in future?
No, I don't understand the question.
Ma'am, I repeat, once we create a sign-in in Cochrane, can we have an option to create a folder or library within the Cochrane so that we can refer to that in future? Like we can save the article and our searches in the folder. That's what
in the Cochrane library, yes, you can save your searches in a folder. Like in PubMed also, you can save your searches. In Cochrane library also, you can save.
Okay. One last question we can take. Is there any minimum number of studies in the findings of a systematic review?
No, there is nothing like a minimum number of to initiate a systematic review. In fact, a systematic review can also be initiated in absence of any published, although it is the norm is that many studies will be published, some will favor some intervention and other studies will negate the intervention. So there will be positive trials and negative trials. So there is clinical equipoise, and then you do a systematic review to know what is the clear-cut evidence on this topic, right? That is the basic premise. However, in order to be able to do a meta-analysis, you need 2 published trials to be there, to combine them in a meta-analysis.
Okay, I think...
Muthu, 2 people have raised hands. You can give opportunity for them to speak.
Yes, ma'am. I think the host can allow the participants who raised hands to,
Actually, I have another assignment now. I have to go for another meeting.
Okay.
Already there are questions that we can answer, but it will be difficult to go beyond the time. Because I have another assignment to complete.
Okay. Okay. I think that's all the questions which is posted in the text box.
Somebody has raised hand, somebody has already raised their hand, so we can answer that question.
Yeah, the host can allow them to unmute and talk.
Sir, that feature is not in the webinar. We cannot unmute them.
Okay, fine.
Yes,
Okay,
they are just attendees.
okay, fine. Thank you. Then in that case, we'll come to the end of the presentation. I request again Dr. Lata Venkatesan ma'am to have a final comments on that.
Yes. Madam, it was such an enlightening session. And I think so many participants have joined, around 270 participants have joined. And for them, it was really a good orientation to learn about Cochrane. And we will be, from CNRS, we will be strengthening the expansion of Cochrane network within India, and we will make the Cochrane network more popular among the nursing students, faculty, and the working nurses. And ultimately, we will also link how we are promoting evidence-based practice in the clinical area. And we would like to continue to associate with you, madam.
Sure, yes, yes, yes. It's quite possible. We are both here, so it's very easy, and we will be holding our workshops regularly. So last workshop was held yesterday, and next we will plan within the next 2 months. So people can come and join us. They can look up our website is called Cochrane India Network and org. Cochrane India Network.org. So they can look up the website to know about the next announcement.
Okay.
Thank you.
Once again, thank you very much for joining us today, despite your busy schedule, madam.
Thank you.
We expect the collaboration in future too. Thank you.
Thank you. Thank you very much.